Hi YouTube. So I thought I'd do a short video on um, the first medication that I'm going to be taking, which starts tomorrow. Yeah. Um, Very excited to get started. We've been waiting 4 years for this, so it's obviously, a long time coming. Also quite nervous, but it's really good to get going. So I'm going to be talking a little bit about the Synarel nasal spray. Um, Sort of how you use it, what not to take it with, and some of the side effects that you can get with it. So yeah, just be a short video on that. So let's have a look. This is the Synarel nasal spray. It's a little bottle it comes in. It's important on here. Each spray delivers 200 micrograms of nafarelin. Yeah, that's a little bottle it comes in with the safety cap and everything. And you pump it like that. So let's take a look at the instructions. Quite a long list. Yeah, so it's the nasal spray. What's important? So this can be used to treat. It is for IVF and infertility, and also for endometriosis. So it's got a couple of uses. It works by reducing the normal response of your body to a hormone called GnRH. Okay, this is going to be funny me trying to pronounce this. Gonadotrophin releasing hormone. That's what GnRH stands for. As a result, your ovaries produce less of another hormone called estrogen. So that's what they mean when they say you're going to be going through a mini menopause. It reduces the estrogen in your body, stops you from ovulating, basically. You'll notice the reduced amount of estrogen usually by your periods either stopping or being reduced in amount after by 1 month of taking Synarel. Yeah, it needs to get into your bloodstream before it can work. So that's probably why you have to take it so long, because it takes a while to get into your bloodstream. Yeah. And the reason it's a nasal spray and you can't take a tablet is because your stomach acid will digest the chemical before it has a chance to get into your bloodstream. That's why it's a nasal spray. Or for some people, they have injections, but I've got the nasal spray. Yeah. Okay, so what you need to know before you take it. You're not to use it if you're allergic to anything in the ingredients, or if you're pregnant. I probably wouldn't be needing it if I was pregnant, would I? Anyway. Yeah. Or if you suffer from vaginal bleeding of which your doctor could not find the cause, or if you're breastfeeding or under 18 years of age. It's all pretty straightforward. Yeah, other precautions. Don't talk to your doctor if you suffer from polycystic ovary disease, if you think you might be pregnant, or there's also been reports of depression in patients taking Synarel, which could be severe, and to talk to your doctor if that develops. Okay, so other medicines and Synarel. Decongestions, that's quite an important one. It says here they're not to be used within a 30-minute period before taking a dose of Synarel, as it reduces the absorption of the medicine in the nose. Yeah. But if you've got a blocked up nose, you can still use this, because it will still absorb. And if you've been using an oral contraceptive, you need to stop taking them before you use them. And you're better off using a diaphragm or a condom. Which is another important thing that the nurse told us when we went, is that as soon as you start the treatment, from the day that you call up, when you have your first period and you call up to book your treatment, use protection from there on out, because if you do become pregnant, which may sound like a good thing, but if you start using the spray, there's an increased chance of miscarriage. So yeah, you don't want to go through that. If they can see that you can conceive naturally, you probably have the treatment taken away, which you don't want to happen. So yeah, as soon as you start going for this, and you start doing your medication. As soon as you're called up, really start using protection, either a diaphragm or a condom. So yeah, let's get back to this. Driving using machinery, no known effects. There's just a bit on how to use it. It's for endometriosis, we don't need that bit. For fertility programs, you do one spray into both nostrils in the morning and one spray to both nostrils in the evening. So you're doing altogether 4 sprays of it a day. Yeah, you usually take it no longer than 8 weeks. It's important to keep spraying, because if you miss a dose, it can interfere with it, and again that will delay your treatment. Then there's just some little diagrams on how to prime it and how to use it. It's quite straightforward. Tip your head forward and to the side to spray it up, and then tip your head back when you sprayed in both nostrils and let it absorb. Right, what else we got? Just how to clean it with water. It's pretty straightforward. If you use more than you should, contact your doctor or go to the nearest hospital department immediately. If you forget to take it at the proper time, take it as soon as you remember, and take the next spray at the normal time. Make sure you don't do a double dose. Yeah. Side effects. Oh, weight increase. Fun. Swings of emotion. Probably won't see any difference with me anyway. Sex drive decrease, headache, hot flushes, nasal irritation or inflammation, acne, oily appearance on the skin. A lot of these are look similar to the contraceptive pill, apart from breast size decrease. Haven't seen that one before. Let's hope we don't get that then. They're very common ones. These are common. Allergic reaction, weight decrease. Some of these contradict each other, but I suppose it's different for each person, isn't it? Depression again. Sex drive increase. It's different to the other one. Insomnia, bone density decrease. That's an odd one. And then there's some very unlikely ones. Yeah, and then just how to store it and some of the bits. So yeah, that's pretty straightforward. We'll start tomorrow. I'll do another video tomorrow of me actually using it and showing you how I get on with it. I won't record all the ones that I do, and I'll just record the first one so you guys can see how it works. And then if I do get any of the side effects, I'll definitely do a video on those. If there's other people that experience the same ones, it's nice to know that other people get them as well and it's normal. And so that's it from me for now. I'll see you tomorrow morning.